Welcome to Disability Clinic, where we make your neurology clerkship learning experience more accessible. Hi, my name is Dr. Van. I'm an interventional pain management specialist in the Department of Physical Medicine and Rehabilitation, and I give continuing medical educational talks on disability and medicine. To prepare you for the clinical setting, I want us to dive into some tough cases and ask yourselves, what would you do in these situations? Today's cases: the R word, interpreter, crazy, normal, restraint. The R word, part 1. You're seeing a patient with an attending and a senior resident. Your patient is a 30-year-old man who sustained a significant brain injury after aneurysm rupture. He is nonverbal, but he smiles when his mother addresses him. The attending is speaking only to the patient's mother and their health aide. They report the patient is experiencing pain over the last 3 months, particularly with position changes for hygiene. Later, when discussing the patient, the attending refers to the patient as the R word. What would you consider changing about the approach to this patient? How can this attending model more inclusive care for this patient? Pause the video and jot some thoughts down on your worksheet, or take a moment to discuss this with a colleague. The R word, part 2. After the attending moves on to the next patient, your senior resident who saw the case with you stops you and asks, "What is the point of caring for a patient with such a low quality of life?" How would you respond? Jot down your ideas. Interpreter. A 74-year-old deaf man comes to clinic for hip pain. He uses an ASL interpreter and hearing aids, but the attending who goes to examine him is not pausing for the interpreter to translate his speech before he begins his exam. The patient is looking anxiously to you for assistance. How can you intervene and advocate for the patient? Crazy. You received a consult to evaluate a 45-year-old woman with history of bipolar disorder, migraines, fibromyalgia, and substance use disorder, who was admitted after being a pedestrian struck by a car and sustained multiple fractures and a subdural hematoma. She's in a lot of pain and requests IV morphine from every staff member she encounters, but the primary team have only been offering her non-opioid options. The doctor consulting you tells you she's a frequent flyer, she's crazy. How could this scenario be approached differently? How can the care team model more inclusive care? Hopefully you're putting down at least 2 or 3 bullet points of your thoughts for each of these cases. Normal, part 1. You're seeing a new consult on the stroke service. She is a 30-year-old woman who sustained a significant ischemic infarct in her spinal cord at T6 and is below her functional baseline. She has new bilateral leg weakness, paralysis, loss of bladder and bowel control, amenorrhea, and nerve pain. The patient's family are in the room during your evaluation. After you finish your history and physical examination, they ask you when their loved one will be back to normal. How might you respond? Normal, part 2. After her family leaves the room, she asks you about infertility after spinal cord injury and asks if her menstrual cycle will ever be back to normal. She's hoping to have more children and becomes tearful at the notion that this might not be possible. How can you provide reassurance? Restraint, part 1. A 24-year-old man was in a motorcycle crash and sustained a brain injury 2 weeks ago. Compared to his baseline, he is more impulsive, has memory deficits, and is not always agreeable to his scheduled therapies. One morning, right before scheduled physical therapy, he calls one of his friends. He tells his friend that he feels trapped, they're giving him all kinds of meds, and he wants to go home. Understandably, his concerned friend rushes to the hospital to pick him up. While his friend is on the way, you're speaking with him on the phone, and he's angrily asking for explanations about the patient's quality of treatment and why you're keeping him locked up in the hospital. He demands to know what medications we're giving his friend that might be messing with his brain. How would you approach his questions? Restraint, part 2. After you get off the phone, your patient is becoming more agitated and combative. He is visibly restless and not responsive to questions, and he's grabbing at objects around the room. Suddenly, he throws an object toward the physical therapist. He's demanding to go outside to meet his friend. 2 nurses come in and help restrain him safely. They are looking to you for direction. What do you do? In medicine, there will always be tough cases. How might you approach them differently moving forward? Thank you for going over these cases with me and with yourself and with colleagues. If you enjoyed thinking through these cases, hit that like button and subscribe to Disability Clinic, and leave any thoughts or comments from your bulleted lists or conversations below. Thank you so much for watching, listening, and learning. See you next time. See you later. Tough cases.